Hello, I'm Dr. Alex Matheson here at Matheson Dentistry. We get lots of questions about dental implant restorations. So today what I want to do is talk about some of the common questions that we get in hopes of helping you to understand about how dental implants are restored. So a dental implant restoration is the teeth that sit on top of the dental implants. A dental implant is a titanium screw that gets inserted into the jawbone, and then we'll put either a tooth or teeth on that implant or implants. And so the restoration is the part of the implant that you'll see that comes out of the gums that looks like a tooth. So an implant restoration entails first having the dental implants placed. So the implants are the screws that go into the jawbone. They need to be placed and then they need to go through a healing period. That's different for every situation, but it's usually about 3 to 4 months. Once the implant is healed into the bone and we've checked to make sure that the implant is well integrated into the bone, then what we'll do is take an impression. Usually in our office, we'll take a digital impression so that we can see in the lab what the surrounding environment looks like. What do the teeth on either side look like? What do the gums look like? So that we can make a tooth that looks very natural coming out of the gums and that fits with the overall scheme of all the other teeth.
How can I make my dental implants white again?
White again? Okay.
Yeah, that one kind of just was not on the same path as the
Okay.
other question, but yeah.
All right. So, so when you're getting a dental implant restoration, it's really important to talk to the dentist about shade of the tooth. Now we can make the dental implant restoration any shade. And typically we'll want to make it the same shade as the surrounding teeth. So if you want to whiten your teeth, the best time to do it is before we restore the implant so that we can match the new tooth to the surrounding teeth. And if we want to make that whiter, it's best to do that at the beginning. Reason is, once you have the dental implant restoration in, you can't make that whiter with just bleach. The only way to make that whiter is to remove it and do another one that's whiter because it doesn't bleach on its own. So if you're wanting to whiten your teeth and you haven't had a dental implant restoration yet, then it's best to whiten your teeth first, and then we restore that tooth so we can match it to what your teeth will look like after they're bleached. So when you have a single implant, you can get it restored a couple of different ways. You can get it cemented on, or you can get it screwed on. And there's pros and cons with both. All things being equal, the better way to do it is a screw retained one so that it's retrievable. So let's say further down the road something else happens and we need to change the restoration on that implant. It's always way easier to be able to just unscrew it and take it out than to have to cut something off. And that's the case when you cement it on. So it definitely is possible to do a screw retained restoration. In some cases, especially in the front teeth, it can be a little harder or tricky depending upon the angle of the implant. But in most cases, you can do a screw retained implant restoration. So dental implants have a very long life expectancy if they're placed well and if they're cared for well. So there's two parts to making a dental implant restoration last a long time. One is obviously the dentist who's doing it, and if we're doing our job correctly, we're selecting all the right parts for this implant, we're getting the bite right, we're making it so that it's very cleansable. All that goes into how long this implant restoration is going to last. And then the other part is what your role is in all of this, and that's the home care. So that's flossing every day, that's brushing twice a day, that's coming into the dentist every 6 months so that we can check and make sure that everything looks good around your dental implant restoration. So dental implant restorations can be replaced a number of times. Now we try not to, we want to get it right the first time, but there are times when we do want to change something. Maybe you decide you want to whiten your teeth. And we know that the restoration won't whiten and your teeth will. So if you whiten your teeth and now all of a sudden your dental implant restoration is darker than the other teeth, we might want to replace it. And that's definitely a possibility. The other thing is maybe you have an implant restoration and it's been there for a while and you lose a tooth or a couple of teeth next to it. Maybe instead of having a single tooth implant, maybe now we want to do a bridge, an implant bridge, and put another implant and bridge between the implant you had and the implant that we're going to place now. So there's a number of reasons why you might want to replace a dental implant restoration, and that certainly is possible. Now, we don't want to do it all of the time because just like any parts, parts on a car, parts on any kind of a machine, they can wear down over time. And there are threads and screws involved with dental implants, and they can wear down. So you don't want to just continue to restore it and change it. But you can do that a few times. So that's definitely a possibility. So dental implants are very, very successful. Now, it does happen that sometimes an implant will fail. And depending upon what study you look at, because there's a bunch of different studies that look at the longevity and the success rates of dental implants. Usually dental implants are about 98, 99, 97% successful. So that being said, if a dentist places 100 implants, it would be pretty normal to have one or two failures where the implant doesn't integrate to the bone like we want it to. And that doesn't necessarily mean that anything went wrong. That's just kind of the numbers. So, here at Matheson Dentistry, one of the things that we really try to do is if someone has an implant failure, which is really not very common, most of the time we'll just replace it without charging anything extra. Just replace it and keep right on going. So there can be a few reasons for implant failure. One of the big ones is micro movement. So if we place an implant, typically we don't put the implant restoration on until about 3 to 4 months later. And that's because we want it to integrate into the bone. And that first couple of months is really critical for that to happen. We don't want any kind of stress or micro movement on that implant. But there's other things that can cause a little micro movement on that implant. So certainly if you're playing with the healing abutment with your tongue or moving it with your fingers or trying to chew on a healing abutment, even though it doesn't come up as high as the teeth, that can cause micro movement. So super important that we don't touch it or play with it with our tongue or hit it with things or with food, just because we want to stay away from that micro movement. Now, the other thing that can cause implant failure is infection. And so it's really important to follow the dentist's guidelines for after implant surgery. You want to take your antibiotics, you'll want to use your antiseptic mouth rinse to help prevent any kind of infection. So when we take those precautions, implant failure is really, really rare. There are instances in which we can save a failing dental implant. If you have an infection around it, there are circumstances where we can go in and do an implant saving surgery. Sometimes we'll use lasers, we'll use certain chemicals that help to clean the surface of the tooth, other things that we might have to do. So just because an implant is starting to fail doesn't necessarily mean it's a goner, but in some cases it is. So if you feel like you're having any problems with your implant, make sure you come on in so we can take a look at it. So one of the ways that you can help prevent your dental implant from failing is really keeping up with hygiene. That's one of the biggest problems with teeth, with implants, with anything in our mouth, is making sure that things stay clean. So proper brushing, proper flossing, and any other things that your dentist or hygienist suggests for you. Sometimes we'll suggest that people use a proxy brush, which is like a little pipe cleaner on a stick. Sometimes there's other things that we might recommend that will help you keep your dental implant restoration clean. So one of the biggest things that you can do is really keep that dental implant restoration clean. So creating a dental implant restoration can take anywhere from 2 weeks to maybe a couple of months, just depending upon what kind of implant restoration it is. If it's a single tooth implant restoration, typically that can be turned around in about 2 to 3 weeks from the time that we take a digital impression of that implant to the time that we're actually delivering the implant restoration. For other ones, maybe like all on fours or those types of full arch implant restorations, those are a little more tricky, and those can sometimes take a little bit longer in the lab, maybe 3 weeks, maybe sometimes 4 weeks to get that done. Well, the best way to know when your implant is ready to restore is really just time. We know that implants need a certain amount of time to integrate into your bone. So usually we just use time. We wait about 3 to 4 months before we come back to restore your implant. There are other things that we can use. We can use a little device it measures what we call the ISQ measurement that measures how stable your implant is. But really the biggest thing is just time. We need to give it about 3 to 4 months before it can be restored. Well, I hope this answered some of your questions about dental implant restorations. If you're missing a tooth or you're hoping that you can replace some teeth that you've been missing, please give us a call here at Matheson Dentistry at 480-888-8123. We'd be happy to set you up with a no-cost consultation where you and I can talk about how we can get some dental implant restorations for you and how that can help your life.